Well, thank you very much indeed, Irvine, and what a great privilege to be here, and what a great privilege to witness that wonderful speech and to follow the First Minister and hear his vision, his wisdom, his passion and his commitment. The NHS does feel like it's quite safe here in Wales, doesn't it? So really encouraging to hear that. And what a privilege too to join you and to offer my congratulations on the Commission's great work and on this conference and the lineup you've got here, and also to be in a room with what I suspect must be the movers and shakers of the health and care world in Wales. So great to be with all of you. And I've also got a personal reason why it's really good to be here, because I'm married to somebody called Sian. She was actually born Jenkins, so you are from Brecon. And so it's a great excuse to come back to her homeland and to your beautiful country on what if, well, it was a beautiful day when we could see the outside world. I hope it still is at the moment. Let me start with a couple of reflections. I mean, firstly, 75 years on, that shows how powerful these ideas are, that they have lasted. And let's pay tribute as well to all those who have nurtured them, including, of course, all those locally here. People sometimes ask, will the NHS survive? Well, as we've already heard, it's a matter of public and political will. The answer is yes or no, depending on which way you go on that. Folk with belief. I hadn't heard that expression before from Bevan, and I expect we'll hear lots of quotations from Bevan during the course of the day. But isn't that true? If we have the commitment, the passion, publicly as well as politically, then of course the NHS will survive. And the real question we should be asking, and I think it's the question the Commission is asking, is how do we maintain a service that is free at the point of need, that is equitably available to everybody in today's changed circumstances, because of course we all know how changed they are from 1948, but before that. Let me also just, in these opening remarks, pay tribute to two great Welshmen from whom I have learned a lot and who have sadly died in the last 3 years, and I'm sure known to many people here, Professor John Wyn Owen and also Sir Eldred Parry. Two people whom, as I say, I've learnt an enormous amount from those times, so it gives me pleasure just to have the chance to pay tribute here in Wales. Where I'm coming from, my background's philosophy. I've worked as a community worker, I've worked in business, I worked at the NHS for 20 years, and these days I work largely in Africa, and that'll be reflected in some of what I have to say. So, my starting point is really three things. Thinking where we are today, well, we have to deal with the current crisis, and it is a crisis, isn't it, with the existing tools and methods, but we have to plan for the future and create vision and hope. And I love the First Minister's approach of emphasizing the positives around that. We must preserve the values and ambition, but the issues and our knowledge have changed. And I'm going to touch on that, but you know, all the stuff about social determinants and everything else have changed, and our approach has to change. And I believe it's about evolution. There are lots of people who talk about reform, and reform is something you do to other people, I think. Whereas actually there is the knowledge and the expertise and the interest and the commitment within this fantastic family of the NHS across the United Kingdom to actually be able to evolve and grow. And Bevan again said something about the service must always be changing, growing and improving. It must always appear to be inadequate. So it's about evolution. And then finally, we do need to determine the vision, the purpose and the roles before considering in detail the organisation and financing and other consequential matters. I see so much in the press where people start off with the money without actually talking about what you're trying to do with it. Let's make clear what we're trying to do with it in today's service and in today's life, and then think about that. So I offer you three propositions for the future. There's so much one could say on this set of topics, but these are my three. First one, we must take off our NHS spectacles. Some of you are old enough to remember NHS spectacles. The second one is a great quotation from a good friend of mine, Francis Amazwa, who was running the Ugandan health service at the same time as I was running the English one, which is health is made at home, hospitals are for repairs. And the third one, more surprising perhaps, is we need to redesign professional education. And I'm going to touch on all three of those in my time now, and do so fairly rapidly, I hope. So let's start with taking off our NHS spectacles. And three aspects I just want to draw out. Firstly, we need to challenge our assumptions. Not many business models from 1948 survive. So organizational staffing and delivery models are all going to have to shift in today's world. We can look abroad. Now, people normally talk about looking abroad to high-income countries. I look abroad to low-income countries, where people without our resources, without our baggage of vested interests and history, are innovating in some interesting ways, and I'll show you an example in a moment. And of course, we need to look outside the health and care system, because all of us know, and Michael Marmot's joining us tomorrow, so we'll certainly know tomorrow, that something like 60–70% of our health is due to things that the NHS and the care system simply cannot deal with. It's about all those external factors that affect our health. So, taking off our NHS spectacles, and what that means is some fundamentally changing relationships between people, communities, businesses, schools, local authorities, government, all have roles in health. And the First Minister said something about a new compact, didn't he? And I know that my colleague Chris Ham is going to say something about that later on. I think there's a wider compact here, and a changed aspect and changed roles. And I'm going to give you this example of the community health workers in Westminster. In much of Africa, but also in Brazil, they have community health workers who are local people, generally local women, 6 months training, and their job is not to respond to need, but actually to visit every house in a neighbourhood, discuss with them health issues, whether it's vaccinations or family planning, or whether or not this limp is bad enough to take me to the hospital, and all those kind of things, and help them think, well, why did the doctor say that? And get them, help them in all kinds of different ways. Well, those sort of community health workers were introduced in the Borough of Westminster in November 2 years ago, November 2021. And they visit every house in the borough, and they do those sort of things. Every house in their particular neighbourhood, and they do those things. They're local people. They understand the local culture. People will talk to them because they're people like them. It's been very successful. It's reduced a lot of demand on the NHS as it happens. It's also improved health in a number of ways, even in that period. They've now got 30, and 1 or 2 other parts of the UK are starting to do that. And I think that shows, you're bringing, they're part of primary care. They're reporting into the primary care system. So you're bringing community facilities and activities and people within the primary care system. And I think we'll see more of that, breaking down some of those barriers between the professionals over here and the rest of us over here in a different way. It's a change, an important change set of relationships. Interestingly, and I just say this as an anecdote, the community health workers in Westminster are actually done on the Brazilian model, and they're mentored by Brazilian community health workers, presumably over Google Translate, over Zoom. So this is a real international effort in improving care. And it wouldn't surprise me, those of you who are working in primary care, if in due course we'll see much more of this type of thing happening. That model or other models in terms of shifting the way in which primary, community, and indeed social care work. And the second one is the Healthy Homes Bill. I'd love to have been able to say this to the First Minister. I've got a bill in the House of Lords which is about, ensures that the Secretary of State has to ensure that all new homes promote health, safety and well-being. You'd have thought they would, but you only need to look at that poor child who died of mould in Lancashire, or the girl in London who died of air pollution in her own home, or Grenfell Tower, and I'm sure you've got your own examples here, haven't you, in Wales, of the ways in which bad housing, just bad housing, dangerous housing, can affect people in all kinds of ways. So we've set up this bill, and it's enthusiastically supported by the Lords and enthusiastically repulsed by government. But what I've done is, because they can kill off private members' bills, but what I've done is I've put it all in as a set of amendments into the Levelling Up Bill, which you may know is going through Parliament. It'll be voted on in September. I think we might win in the Lords, and then the Commons will have to vote on it. So there's a real fight there. And do remember that Bevan, of course, was Minister of Health and Housing. And all ministers were ministers of health and housing till, I think, sometime in the 60s, but some historian here will tell me, but really important things. So real changes in what we need to do as health and care people in terms of shifting the agenda. So let me move on to Health is Made at Home. Hospitals are for repairs. And this is about health creation, because there are 2 ideas here. Firstly, that the home is important, and the environment, and health is made at home in the community and society locally. But it's also the notion that you can create health. We talk about, and the Minister was talking about positive rather than negative, we always talk about pathogenesis, the origins of disease. We don't talk about salutagenesis, the origins of health. But we begin to know what the causes of health are. Recent article in JAMA, the Journal of the American Medical Association, saying that having meaning and purpose in life is good for your health. We know that having social networks is good for your health. There's a whole lot of things like that. We know exercises, we know food. I mean, a whole range of things. Why don't we concentrate a bit more on some of this creating health? Now, this isn't so much for the professionals. I have 3 examples here. With Francis's permission, I wrote a book with that title, which illustrated something like 60 examples. And let me run through them terribly quickly, just a couple of them. TR-14ers. This was a policeman in Camborne, down at the, well, I'm not sure quite which direction it is for here, but down at the tip of Cornwall, not that far away as the crow flies, who was fed up with chasing the kids for vandalism and minor crimes. And he started to work with them, and they set up a dance club. Now, the kids were rather surprised to find themselves dancing with policemen. But that club has been going for 14 years now, 15 years, I guess. 2,000 kids have been through it. They run it now. And the University of Exeter has demonstrated this has improved mental and physical health and well-being for those young people. A health visitor helped him to think about how to do some of this, but essentially this was a non-health person creating health in his neighbourhood. Incredible Edible, this is a group of middle-aged women in Todmorden, not far from Leeds, who decided they were going to start growing vegetables in public places. They reasoned that, the police weren't going to arrest a bunch of middle-aged ladies, growing carrots outside this primary school or whatever. But they were doing it because it was propaganda gardens, they called it. People came and said, what are you doing with that? And from that grew food festivals and bringing people together, swapping recipes with the Syrian refugees, a sense of building a community, of bringing people together, supporting the local economy, all of that. There are now, that was about 12 years ago, there are now 150 incredible edible groups around the country who don't really have any rules. They do it whatever it's appropriate to do in Oxford or in Conway or wherever it is around the country. And the third example I'll bring out here is just a completely different one. The big firms in the City of London coming together around a City Mental Health Alliance to promote mental health with Create Mental Health, to actually not just provide the sort of fitness and the time-out rooms and the sort of things that we know about, but actually also to change some of the business processes so that the business processes didn't create so much stress, didn't damage health so much, actually created health. Because this was about creating health, and we need to think a bit about health as not just being an end in itself. Why do we want to be healthy? I think it goes back to something about human flourishing. Physical, mental, and social well-being are all about human flourishing. Eudaimonia, for those of you who read Greek all those years ago, or know that Aristotle, the pursuit of having a good life in those sort of terms. And I think that's a really important point. And these are people who are all doing that. They're not health people. And there are some real interesting lessons from them. First thing is, some of you will know the old management saying that culture always trumps strategy. The new chief executive comes in with the strategy, but the culture says it won't work. Well, actually, there's another one. Relationships trump systems. It's actually how a lot of doctors get stuff done. They use their relationships to go around the system, isn't it, of course. But actually, everything I've talked about started with relationships. It was people building relationships. You didn't start with a system. We, from our structured NHS lives, will think, well, what's the system? What's the organization? What's the project management? Actually, this was passionate people getting together and doing stuff, And so relationships are key. They all deal with mental, physical, and social health. It's not about the compartmentalization that we have. It's purpose-led, not plan-led. That's really interesting. We get stuck in our plans sometimes in the NHS. The purpose is to do this. We set out a plan. If it doesn't work, we carry on sometimes with it rather than shifting. It's about learning by doing. And it's about recognizing the point I made earlier about meaning in life and actually autonomy. We're all helpless when we become patients in the NHS. Autonomy is actually one of those things that is health creating. Actually being in charge of your life, getting your life back together, getting your life back. These are all things that are about creating health in really important ways. So let me then jump on to my third point, which was about professional education. I used to co-chair an all-party group on global health in the Parliament, which is now co-chaired by my friend Ilora Finlay, co-chair of this great Bevan Commission. We produced a report, Probable Futures, Radical Possibilities, looking at what health workers would do in 20 years' time. And I'm only going to pick out 2 points. The first one, the really, the obvious one, but so true, is that actually data, technology and science will shape the way that health workers think and act in the future in all kinds of ways. I'm not going to talk about that. I'm also going to talk about the third point here, which is what a number of young doctors said. Well, okay, I'm 25 today, 20 years' time I'll be 45. Am I just going to be a technician? Some of them felt that AI, technology, protocols and management will just mean that they're just following rules. Where's their professional judgment? But link that with the point about the importance of relationships, about influencing the social determinants, which we don't do at the moment, and health creation and so on. And what we developed was the idea that we need to think of our health professionals as agents of change and curators of knowledge, and that they've got this fantastic role helping to manage relationships, advising, influencing, the health visitor advising the policeman in Camborne, influencing, supporting, sharing, and making knowledge available, not thrusting knowledge at you, making knowledge available. And I think Usman Khan's going to talk a bit about health literacy and how important that is. Well, who's going to support that? And this is part of the role of professionals in building this relationship, in being the people who help us to think and work with health in ways that are evidence-based, I guess, that are real and will have impact, and shaping the behavior of individuals and organizations. And my point here is that actually, and we don't often say this, change needs to take place in the most important place of all, which is inside the heads of the health professionals. How they see the world is how we see it. If they think it's doctors and hospitals, well, the newspapers will, and we will as well. So it's a really important point to deal with that. So my 3 propositions: NHS spectacles, health is made at home, and redesigning professional education. Let me finish with 2 points on 2 slides on implementation strategy and tactics. As I said at the beginning, where we are today, we need to deal with the current crisis with existing tools and methods. But we need to create a bigger and wider vision that's not just about healthcare, that sees health and care system as part of a much bigger society-wide set of actions designed to improve health, a health-creating society, which people can buy into and rally behind and create hope. Because I talk to a lot of health workers around the world, and there's a sense of despair and exhaustion for a lot of people who are just hammering themselves against a brick wall. They need something to lift their heads up, don't they? But here's a big point that, again, I don't think is often seen, is health policy must not just address health care. It should address the health of the individual, the health of communities, which is intimately connected with, the health of society, which is about inequalities, and the health of the planet. And different actions are appropriate at different levels. And if I were advising a Welsh government or anybody else about future health policy, I'd say, what's your policy in health about how society needs to deal with inequalities? What's your policy about how communities need to grow and support people? What's your policy about individual health, and what's your policy about planetary health? You need them all tied together if you're going to really make change. And 3 chunky things that I would do in the short term. First 2 are very obvious, aren't they? Invest in primary, community and social care, but actually not just for their own benefit, but also to free up hospitals to be able to do what hospitals are really good at doing. Because whilst I haven't talked about hospitals and tech and all the rest of it, my goodness, if I've got nasty cancer, I want the best specialists in the best hospital, in the best environment to be there. Secondly, we need to implement policies about healthy homes, of course, but healthy schools, healthy workforce, and we need to do that with real urgency. And thirdly, we need to develop professional education so it equips professionals to offer the leadership and support the actions of all of us in the changed environment of the future. I was told I had 1 minute left. I think I'm getting in under the bar, because my very last comment is here in Wales, I believe you've got the real opportunity, haven't you? If you could demonstrate how to change a health system here that we could all learn from in our much bigger and clumsier health system in England and elsewhere around our great United Kingdom. Thank you very much.